Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. You can now subscribe for our free newsletters, the link for which is given on the website. Do like, share, and subscribe for our YouTube channel, and you can follow us on other social media platforms, the link for which is given in the description box below. And in conversation with me today on the Tooth Talk, I have Dr. Satish Kumaran. To give you a brief introduction about Dr. Satish, Dr. Satish is a graduate from the VS Dental College and Hospital. He completed his BDS in the year 2000 with a special award for academic excellence in general surgery. Dr. Satish went on to do his MDS in oral and maxillofacial surgery from the Savita Dental College, Chennai in 2005. He was awarded the state second rank among all branches in MDS from the Dr. MGR Medical University and the college first rank among all disciplines in MDS. Dr. Satish did his MFDS RCPS, Glasgow, UK 2011 and MOM SRCPS, UK 2012. He is a surgical trainee in head and neck oncology in Regional Cancer Center, Thiruvananthapuram, and an observer in the head and neck surgical unit, Germany. Dr. Satish is a member of several international renowned organizations like the FHNO, Nobel Bio-Implant Fellowship, the FICOI Malaysia, and the Asian Society of Head and Neck Oncology. With over 15 years of experience in the field of oral surgery, Dr. Satish has several papers published at national and international journals. He has 16 paper presentations to his credit. He has been the guest speaker at national and international conferences, and he has attended several academic meetings nationally and abroad. He is an international surgical demonstrator. Dr. Satish has special interest in the areas of surgical oncology, pathology of head and neck, orthographic surgery treatment of trauma cases, and dental implantology. He has founded the Head and Neck Clinic in Rohilkhand Medical College. Dr. Satish, thank you so much for joining me in today's To Talk with Your Dentist conversation, and a warm welcome to you.
Thank you, Dr. Rekha.
Yeah. So, Dr. Satish, you've been in the field of oral and maxillofacial surgery, and how has this the second wave of COVID been? I think it's been pretty harsh on most of us. So, medical in medical terms, how would you say the second wave has affected people?
But to be very honest, the entire chapter on COVID in any standard medical textbook is only about 1/4 of a page. So we didn't really know, or rather, we still don't know much about COVID and how to treat the aftermath of COVID, and to even understand whether what most of it we are seeing is actually due to COVID or not. So we have a lot of hypotheses now, and we are seeing things that we were not at all regularly seeing. For example, black fungus. Till COVID started, I had seen probably 3 cases in 20 years.
Yes.
So now it's like we are operating 2 or 3 cases every day, which is not a good thing. And whether this is involved with COVID or whether it has to do with what we are doing to treat COVID, we cannot really blame everything that we are seeing on a viral infection. Corona is nothing but a viral infection. Whether we are doing the correct thing by pumping what we are doing, we are pumping into the patients by way of meds or, I think it will take another 10 years before there is a standard protocol to treat COVID. Till then, everything is going to be very honest, hit and miss to see what happens.
Yes. I think right now it's a lot of speculation. We can't definitely say what, or we don't even know the course of the COVID right now. From what it started last year, and we probably, we had no clue March last year what was happening. We just thought it was possibly one of those infections, that will come and go, and never ever thought it will become a pandemic and such a long-lasting one that too, isn't it?
Yes, COVID as such is not a killer. It's what happens because of the immunity loss due to COVID that is the killer. And you see, 11-year-old children with a fungal disease, I don't think,
Yes.
it was Nobody would have even believed it if you had told it in pre-COVID times that an 11-year-old has a
Yes,
fungal disease of the brain. These things
yes,
are just not possible.
yes,
But
yes,
because of the loss of immunity and the ability of the body to fight back, which is what COVID takes away.
yes,
Maybe you could call it a poorer cousin of HIV. But
yes,
because of the more acute symptoms, even though HIV claims a lot more lives than COVID, because of
yes,
the more acute symptoms and the more suddenness of demise, we tend
yes.
to focus and put the scope more on COVID than more serious viral
Yes.
infections.
Yes. So, Dr. Satish, you have been in the surgical section, and you said you have done so many surgeries. I think one of the most sudden infection that we are seeing, an opportunistic infection, is probably the black fungus infection that the common man knows it as. So, what exactly would you say? In terms of because this probably is an infection that affects the nose and the sinus area and the more specifically the upper jaw area. So that is something related to oral and dental subject. So what do you think is the possible precautions that a patient can take to probably detect this infection early on?
Yes, see, to be very honest, it's not just black fungus. Any fungal disease, because all these are commensals, which basically means these are living within your body. So
Yes.
once the immunity comes down, they create havoc and make merry while the sun shines. So it's not only black fungus; it's yellow, white, and aspergillosis, and fungal ball, and so on and so forth. We are even seeing a lot of people who are coming in with sorry, who are coming in with candida. The kind of people who shouldn't be having candida are coming in with
Yes.
candida, and things are not
Infection.
as good as it used to be before. So whether they're the thing is, it's a vicious cycle of steroids and diabetes and sugars not coming under control and blah blah blah, because you can't do without steroids in an inflammatory condition, and produces inflammatory symptoms where steroids are the first line of treatment. So I think overall, uh, if you are diabetic in this situation, whether you are COVID, no COVID, pre-COVID, post-COVID, better to keep your sugars under control, and then most of the other things will sort themselves out with the proper hygiene instructions, which your
Yes.
dentist will be very glad to share.
Yes, yes. So, Dr. Satish, what according to you has changed in these post-COVID times?
What I would like to do is I have a small PPT here, so if you can give me
Yeah,
uh,
I have done the
permission
screen
to
share.
share.
Yeah, yeah. I have
Yeah,
done the
so
screen sharing
I
with
will,
you.
yeah. So
Yeah.
I will just share this with you. And can you see me?
Yes, yes, I can.
Okay. So, so this is what has really changed. We are seeing these things we are seeing in patients where we were not seeing them before. In young people, in healthy people, we are seeing increased amount of plaque and tartar. Is this because of lack of time between appointments? I do not know, but I think this is more for the Western population than for an Indian population, because in India we don't believe in routine examinations or routine appointments. Unless there is a problem, we don't go to the doctor, which is fine. Different cultures, different ways of looking at it. But my colleagues who train abroad have said that they are seeing increased amount of gum disease in patients, probably because patients are not keeping up their routine appointments with the clinician.
Yes,
There is increased evidence of wear facets. This is probably because of stress.
yes,
Everybody is talking about stressors. Everybody is talking about working from home. Everybody is talking about psychological impact of COVID, pre-COVID, post-COVID, living with a person who's had COVID,
yes,
and all these things also tend to reflect on dental health.
yes,
Mental and dental health is what they are talking about in Glasgow. So they try to rhyme everything. So mental and dental health. So it affects the mind and it affects the jaw, because you start chewing, and a lot of people have come in with temperamental joint problems and myofascial problems because of constant biting of the teeth because of
yes,
subclinical stress. Because of wearing the mask throughout the day, there is increased dryness of the mouth. And this, I think, is very logical, and there is a very straightforward explanation for this because obviously, if you're wearing a mask, you're not able to drink anything, and therefore the mouth tends to get dry.
Right.
And also, because you're staying at home, um, sorry, something just popped off, and I'm not sure what. My apologies. Okay. So, because you're staying at home, working from home, or rather, like me, for the past 2 weeks, I haven't gone to work, and we are tend to snack and tend to eat, and Swiggy and Dunzo and everything coming home. There is no gymming, there is no walking, there is no
Yes.
exercise, and because of this, obviously, and I've also noticed even in friends who used to smoke, who stopped smoking, have got back to smoke during COVID, probably because of boredom and because of so much time on their hands. So
Yes.
all this deals to the enamel wearing off, and there are more number of ulcers in diabetics, COVID tongue because of loss of the salivary glands which are there on the tongue. Black fungus, will come to that later. And
Right.
there are reports of pediatrics, that is children, who suddenly come to you with a permanent tooth in their hand and where there's no bleeding in the mouth. This is
Mm.
something that a lot of pediatricians are seeing abroad. I
Mm-hmm.
do not know about India because we still haven't got the data back from the dentists in India.
Yes.
But
Yes.
over the past 1 year, especially this has been reported in America. The American Dental Association has reported quite a few children coming in with permanent teeth, which have dropped out of the mouth suddenly, without any bleeding or without any noticeable mobility. Is it because of decreased blood flow? We do not know. And there are something called as receptors all over the body, and especially during the inflammatory phase where there is increased blood supply, there tend to be increased receptors, and there is a hypothesis that says the virus also tends to plant itself on these receptors, and wherever there are more number of receptors, there is an increased viral load in that particular area. But these are all hypotheses. So you were asking me about black fungus. So these are a few things that you need to worry about in black fungus. It's generally a vicious cycle of um, terribly wrong. Okay, it's a vicious cycle of steroids and sugars. For inflammation, they give you steroids because steroids is a life-saving drug in COVID. It's really a life-saving drug. And then your sugars go up. There's a 50% facility, and trust me, I don't think any of us really want to treat a black fungus patient. It takes many visits to the operating room, and there's a 50% facility. 50% of them die. The signs are a stuffy and bleeding nose, swelling and pain in the eye, drooping of eyelids, loss of vision. But most important thing is try to see if there are any splodgy black spots around the nose. It might not necessarily be black, it may be a discoloration, it may be purplish, but anything that is off the ordinary and in and around the pink part of the nose and in the mouth, it's a good idea to get it checked. What we've done in my practice, which is primarily head and neck with a little bit of dental, is we are doing video conferencing with an intraoral camera, and we are checking for the patients. But I understand that not everybody will have that facility, and you can check it yourself or your partner can check it at home. And try to come as early as possible because most of the times we have to remove the eye to stop the infection from reaching the brain. So I'm going to stop sharing now so that we can go back and discuss what we've just spoken about. So are we back? All right. So is there anything you would like to expand on with regard to what I have just spoken?
Yes, no, I was just wondering, would there be any intraoral signs, like say a sudden mobility of teeth that patients will experience, or would it be safe? Patients will want to know, would it be safe for them to visit their dentist for their routine checkups now because the also the threat of the black fungus infection, and probably I think also there have been cases reported where people have been in home quarantine and have also developed the black fungus infection. So if you're attributing it to so many other causes, for people who are hospitalized. So what would be the chances that somebody in home quarantine developed an infection? So is it advisable that they start going to their dentist for the, suppose somebody who has just recovered from COVID also, would it be advisable that they go get a checkup done with their dentist at this time?
So what usually happens is the virus tends to, like, everybody is being harping again and again. It tends to decrease the immunity, and the first thing that happens is gum disease. But unfortunately, in COVID, it appears that the gum disease is not the usual kind of boggy, blood-filled gums that you see. It's more like, a giving way of the architecture of the periodontium, which is nothing but the gums. So whether you can see it at home, to be very honest, the only cases that we've seen, or rather my colleagues have seen, is adult patients, diabetics, fungus. Youngest patients, the pediatric group, again loss of immunity, fungus. We really haven't seen anybody between that 15 to 25, 30 age group who don't have comorbids and who've developed black fungus. This basically says a healthier lifestyle with increased immunity should be the thing. It's very difficult for you to actually check what you want to check because it's the mouth. If it was the hand, I can see my hand. But since it's inside the mouth, it is very difficult for an untrained person.
Yes.
Having said that, it's a double-edged sword. Nobody wants to go to a dental practice. I don't want to go to a dental practice myself because there's no guarantee that you are not exposed to the
Yes.
virus. So I think, to be very honest, what you need to do is do proper home care, check
Yes.
yourself thoroughly, and if there is any doubt, have a teleconference with your dentist, and then ask the doctor to sort out your issues without reaching his or her practice.
So something like a sharp pain, something like sharp pain in the sinus area or something, which is probably
Surprisingly, none of our patients have really spoken about acute pain. The
okay.
thing is, I'm very happy if I have a patient who says I have acute pain,
Okay.
because acute pain means in the head and neck region, it's not a heart attack. There is no heart there. Okay, and, and acute pain means that good, you come to me in time for me to do something for you.
Yes.
So, and it's all the things that don't cause pain that are the things that really give the clinician a big pain. Because,
Yes.
for example, cancer, nobody comes to you in time because it's painless.
Painless. Yes.
And it's the same thing with COVID. It's very mild, dull, aching, stuffy sinus. You can't blow your nose. So people, let me see tomorrow. Let me see tomorrow. And the problem is, it destroys so fast that
Yes.
even 24 hours can mean the difference between you losing an eye or not losing.
Yes. Yes. So, Dr. Satish, what do you think? Probably some, again, like how from the beginning of COVID, people have been stressing on cleanliness, hand hygiene, wearing masks, and doing things like that. So, probably, some cleanliness regime, even to prevent this kind of a the black fungus infection. Say, for instance, because this is a predominantly a fungus that is present everywhere, in rotting vegetables or on even on other soil areas and things like that. So do you think any other kind of precautions, like say washing your vegetables when you get it before you store it, or some things like that, would that be helpful to the patients?
I don't really know about food because, washing vegetables, yes, everybody needs to do that, and cooking, and most of us don't eat raw, and even the vegetables that are cooked are a different issue. I'm just going to share my slide now to tell you what the Indian Dental Council has recommended. So,
Yeah, I have shared the screen now. You can do your screen share, Dr. Satish.
okay, can you see me?
Yes, I can see the slide also. The slide is also
Okay.
visible.
Okay, so I think before we go on to discuss what the patient can do, we need to discuss what we as professionals can advise the patients. A change in diet is extremely, extremely important. because, like I said, staying at home, we've all become couch potatoes. And it needs to be stressed that a good diet is very important and a healthy diet is very
Yes.
important. To cut down on starches and to cut down on cool drinks and sweetening products is extremely important. And people may think that just because they're staying at home, oral hygiene routines can be disturbed. It's not really done.
Yes.
And to be very honest, in India, teeth are always secondary. Always they say, "We will take a
It's,
think
it's
about it later." So
it's
that is
never
a
a
fact.
priority.
It's never a priority. You see, and you have to tell the patient that what I tell all my patients is keep a bottle of water with you and make it mandatory to pull the mask down and just have a sip of water every 15 minutes. It just takes a few seconds to do that, and it goes a long way to prevent the dehydration and drying of oral mucosa. And identifying patients who have mental problems is very important. And more than the dentist, it is important for you to identify and refer them to one of your colleagues who can counsel the patient, so that that is sorted out. And once the mental issue is taken away, then the habit can be broken quite easily. Like I said, teleconferencing to see whether you have gum disease is
Yes.
also
Yes.
extremely important. So
Yes.
coming to your question on what the patients
Patient.
can do,
Yes.
drink more water. And
Hmm.
what I do is, okay, I have the benefit of not having neighbors. So we tend to go upstairs by around 5-ish, and then we try to come down by around 8:30, 9 in the evening, and make sure that we tend to ventilate ourselves. It's very important to make sure that there is adequate ventilation while
Yes.
maintaining social distancing. And drink lots of water, and antioxidants have been proven to fight both against the virus as well as gum disease. So lots of green leafy vegetables, and now the season is, you get enough varieties of fruit and vegetables to help you deal with your diet and oral issues. Really benefit from these
Yes.
dietary changes. No sugars, less acid, and this is going to put me into deep trouble with most of my dear friends. But absolutely, if you can avoid alcohol, it's all well and good. And
Hmm.
avoiding alcohol and tobacco is extremely
But
important. And this is also something that I found is useful. Uh, Inhalation with whatever Carval Plus or eucalyptus oil, and using nasal saline sprays, my ENT colleagues say, goes a long way towards preventing viral infiltration into the nose as well as the blood. We do not have any studies as of now whether it's useful or not, but I don't see what harm it can do to just pump a little bit of salt water into your nose. And
I think
fluid.
nothing should be overdone. I think nothing should be overdone. Everything in limit.
Yeah, it's just saline. No? It's not like
Yeah.
it's a chemical. So
Yeah.
it doesn't matter even if you do it 15 times a day. What does it matter? It's just a little bit of salt water.
Okay.
So I would advise not to use all the medicated nasal sprays, but pure saline nasal spray should be fine. In fact, we are
Hmm.
using it for all our pediatric patients and diabetic patients. Once in 15-20 minutes, also nothing really happens. In fact, I've found that most of them tend to feel better and breathe better while using it, because this is also the pollen season in Bangalore. Bangalore is the asthma capital of the world. So
Correct.
these tend
Correct.
to be
Correct.
useful for those patients also. The American Dental Council has suggested the use of fluoridated toothpaste. And what they also said is, when you're using the toothpaste, don't wash your mouth immediately after using the toothpaste to allow the fluoride to. Again, question mark whether this is going to work in India. Important thing is, do not delay in seeking preventive dental care.
Yes.
Okay. So I'm going to stop sharing now, so we can go back and discuss what we've spoken about.
Yeah.
Are we back? Yes, we back.
Yes. Yes. Yes.
So
So
have I kind of answered most of your queries?
yes, yes. I think like how you said, probably if patients are still skeptical to visit their dentist, probably like a if they are noticing anything that is away from normal, and especially if they have recovered from COVID, probably they can get in touch with their dentist, and require do a video conference call, I mean video call with them, talk to them. And if the dentist feels there's an absolute necessity that he has to see the patient, probably they can give a quick visit, with all the precautions in place.
Yeah, I would like to point out one of the more important things to my colleagues. I see quite a few patients who are coming with mobile teeth. And in the early phases of COVID, I saw a lot of my dental colleagues extracting these teeth. Don't do that, because what I have noticed is once you extract the teeth, the fungus starts behaving like an oral cancer. It starts invading quite heavily, and I've seen one patient, coincidentally, it was not planned, where he actually had a CT scan before the extraction, and they did a CT scan 2 weeks after the extraction. And before the extraction, his sinuses were totally clear. There was nothing. It was a healthy sinus with a mobile tooth because of gum disease. And after the extraction, the entire thing was flooded. And whether it was the extraction that caused this widespread disease or not, I do not know. But it makes sense not to try anything unless you're absolutely sure about the history of the patient.
Yes, yes,
So most
yes.
people tend to hide. This particular patient hid the fact that he had recovered from COVID 3 weeks ago,
Ah,
had uncontrolled diabetes, and so on and so forth. And he has not given anything in the history.
yes,
But
yes,
more than anything else, I think you need to dig like Hercule Poirot to make sure that
yes, yes.
you are
I
not
think
you don't end up
yes.
with the sticky end of the stick.
Yes, I think at this time, even a simple procedure like a mobile tooth extraction, I think it's a huge responsibility on the part of both the dentist and the patient. That there is a lot of transparency there. The patient also. I mean, even I have encountered patients, who have not revealed their history of being COVID positive at some point. So I think there is no need for patients to fear and not reveal these details, because end of the day, it's their health, that is at stake.
I think it's more of the social stigma thing which is
Yes,
attached. When the first wave, we saw a lot of people. Even now, you see in the
yes,
smaller towns where people avoid the COVID patients, and
yes,
it has a lot to do with the wrong side of media.
yes, yes, yes.
Educational media happens to be very minuscule in our
Yeah.
country. But even if you try to put together something good, nobody is going to see it. It's the masala that sells. So if you try to
That's
put together one big, gory picture, everybody starts sharing and everyone is happy to see that.
true.
So, but this patient, we operated and he ended up, losing his eye and blah 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 upper part of the face, and luckily the doctor had uh, a telephonic consent where he denied the fact that he had COVID, so she got away with it. Otherwise, she could have got sued. We need to save ourselves.
But it's definitely unfortunate that the patient had to lose so much of the facial structure,
Yeah,
isn't
I
it?
mean, it works both ways. It's depressing for the surgeon also. It's not
Yes,
a good surgery to do. You don't.
yes,
It's not a feel good factor when you come out of the OT after doing all this.
yes, yes,
You don't
yes.
really feel that you've done something useful.
Yes, yes. So
So,
I think the key takeaway would be that after the second wave, especially with all the other infections that are coming back, especially in the recovery phase, I think patients need not actually fear, but actually they should, I think, reveal history, give their history, and I think also dentists from there and take all precautions. Whether they have to do a proper blood test and taking the proper elicit the proper history from the patient. I think with those kind of precautions, possibly, at least some cases could get detected.
yeah, I have put together a set of precautions that the Indian Dental Association has given all of us for both the patients and the dentists. So I'm going to go back to sharing my screen, and then we can see what the Indian
Yes.
Dental Association has told us to do. So, okay, this is what the clinics can do. Use of face shield and goggles,
Yes.
extremely important.
Yes.
What we found in the head and neck clinic is as long as you can cover your mucosa, which means your mouth, your nose, and your eyes,
Yes.
you're relatively safe because the other things can be washed off.
Yes.
They say that the face shields provide about 96% prevention
Yes.
immediately after exposure to the aerosol. And
Yes.
using the PPE gowns and all that is also very, very important. It is extremely difficult to work in these things.
Yes.
I understand completely
Yeah.
that it is very difficult to work in these things.
Yes.
So,
Yes.
and it's not easy. But
It's not
having said
easy. Yes.
that, what we are doing is, if the patient, to be very honest, if the patient is coming in with a negative RT-PCR, we are not using the PPEs because
Hmm.
it's terrible to work under this. And
Yes.
we've had a few, we've lost a few colleagues in the first wave because of overdoing
Yes.
the PPE thing.
Yes.
So,
Yes.
using disinfectants for all the surfaces
Yes.
around you is very important, and natural ventilation is extremely important.
Yes.
If you can avoid the AC and open the windows, I think that is really good.
Yes. Yes.
And they advocate isolation rooms, but it is practically impossible to have isolation rooms in the Indian scenario. So you can stagger your appointments,
Yes.
such that
Yes.
you have about 15
Yes.
minutes time between patients, and make sure that the patients do come on time. So what
Yes.
we did it in our practice was invariably patients would come late, and what we did was we refused to see them.
Yes.
And
Yes.
then now the people who came back tend to keep their time. Otherwise, you would
Yes.
have patients walking in whenever and wherever. The
Yes.
auntie has to finish the serial on TV, and then only she can come to the practice. So all these things don't happen anymore. So, and washing the hand
Yes.
is very important,
Yes.
and masks is also important. And they are advocating masks without valves. Surgical masks are good. Double masking, is it there? Double gloving? Question mark. But a mask, yes, to prevent the attack of the mucous membrane by the aerosol.
Yes.
So these are the things that have also the mouthwash. I'm so sorry. The mouthwash is extremely important. Anything can be used as a mouthwash. Hydrogen peroxide, betadine,
Okay.
or hexidine can be used as a mouthwash. So the ideal thing is to keep it for 30 seconds to 1 minute inside the mouth. And, these are the recommendations from the um, thing. And what they've asked the dentist to do, considering the fact that in the third world countries that people are hiding the fact that they've had COVID, is to do something called as an individual risk assessment. And this also contains a questionnaire which would be useful if there is a medical legal problem. So
Yes.
the patients who had contact with COVID positive patients or visited a high risk, you should treat as COVID positive. A
Yes.
patient who has had contact with COVID positive but without symptoms should also be treated as COVID positive. Yes, which basically
Yes.
means stage one. If the patients who had high risk, it is better to avoid any active treatment, so on
Yes.
and so forth. And patients who did not have contact with COVID positive patients and did not visit but show flu like symptoms should also be taken as high risk patients.
Yes.
Because what's happened is most patients do not want to get the RT-PCR done. I do not know why,
Yes.
but most patients do not want to get RT-PCR done. It's very silly because it's a very non-invasive procedure. So that is the thing, and but we treat all patients as potentially contagious,
Pause.
and then
Yes.
you shouldn't have any problems.
Yes. Yes.
Keeping yourself, and it would be ideal to do urgent procedures, and if possible, if you can, and the patient agrees, any aerosol elective procedure should be done with a rapid antigen test and a question. So these are
Yes.
the recommendations by the IDA, and these are the recommendations for the dentist also, to minimize the chance of exposure. Post a sign at the entrance of the practice, reschedule appointments.
Yes.
We don't do anything except the emergencies, really.
Correct.
Take a
Correct.
detailed travel and health history. The
Yes.
problem is, even for elective procedures, the patient getting infected or you getting infected from another source is very high. So it
Yes.
would be ideal to reschedule appointments. And we've also told our doctors to take half an hour break between patients, which
Patience.
basically means that they have their own isolation room, and they go to
Correct.
the isolation room, take off the PPE, ventilate themselves for half an hour before starting the next case.
Yes.
I think it is a duty that we have to do ourselves to make ourselves safe.
Safe. Yes.
So take temperature readings, physical barriers, PPEs, autoclaving, rubber dam. All these are the basic things that we are
Yes.
supposed to do. So
Yes.
these are the recommendations from the thing, and I think that covers most of it. And I'm going to stop sharing now to go back to the topic.
Okay. Yes, yes. I think Dr. Satish, that was very useful and informative, I guess, especially, all these guidelines and regulations coming from the authorities and saying what needs to be done on part of the dentist and on part of the patients also. So the responsibility lies with both of them, in taking care of either of their health, because one should not be passing on the infection to the other. So it
Absolutely,
is mutual
absolutely,
respect. It's mutual.
absolutely.
Hmm. So I think that is a kind of a mutual respect and understanding we should have for each other, isn't
I
it?
think all practices, all doctors should modify their practices according to what they feel is safe for them. And
Yes.
there is no right or wrong. I mean, for
Correct.
our practice is mostly, like I said, head and neck with a little bit of dentistry. So relatively, we are safe because all
Yes.
our patients agree to get the RT-PCR done.
Yes.
So if the
Yes.
RT-PCR is not done, we tell them, try to do something to alleviate the situation
Yes.
without trying to do any permanent. I'm sure all the other doctors are also doing the same thing. There are some practices which are dealing with general dentistry, but they tend to protect themselves very well, and then they are doing the aerosol
Procedures. Yes.
procedures. To be very honest, we don't have clear-cut guidelines on how and when to do to
Yes.
restart general dentistry with
Yes.
regard
Yes.
to the COVID scenario. So once
Yes.
that comes in, I'm sure that will come in very soon. So that
Yes.
will come in only after we receive data from all over the place. Without
Yes.
getting the data, it is not possible to recommend anything. So
Yes.
once we
Yes.
have those recommendations, then I think we are also.
Yes. So I think till then, whatever standard precautions that have been mentioned for the dentist, I think on his part he will do it, and from the patients and what they need to give details, be honest with that. I think if they do, it goes a long way in
Absolutely.
helping
The
with them.
first thing they should do is ignore Baba Ramdev. Then everything is safe. Everybody is safe. The guy talks absolute rot.
Yeah. Yeah, I think all the like the very popularly, like everybody says, from the WhatsApp university, I
He's
think
spoken about dentistry also. I don't know whether you know that. He's released a lot of videos on yoga and dentistry and something and something and
I'm
doing breathing exercise to prevent cavities and all that.
okay. I'm not aware of that. I'm not aware of
So
that.
it's quite
Okay.
amusing for the professional, but for the layman, if he starts thinking that this is the gospel truth, then we have to end up repairing everything that the damage has been caused.
Yes, yes. So I think the best thing would be that everybody, get in touch with their dentist and find out, what would be the best option for them at that point.
Yes, and I think they should do a little bit of research also. To be very honest, I think you need to go to dentists who are doing ethical PPE practice to make sure that you are safe also.
Yes, yes,
So
yes,
there is a huge responsibility of the patient to make sure that they are safe.
yes,
So
yes,
there's no point in getting it done somewhere and then
yes,
blaming the dentist because there is absolutely no way you can prove that you got COVID at this particular.
yes,
You got it
yes,
anywhere. There's
yes.
nothing like I went to the dentist or I went to the hospital or I went shopping to the market and I got COVID. It doesn't make sense. You could have got it anywhere. How are you going to prove?
Correct, correct.
So
So I
that's the
think
thing.
end of
You
the day,
need to keep yourself safe.
yes, yes. End of the day, it's your responsibility to keep yourself safe and keep others
Yes,
also
yes.
safe. Yes,
I
yes.
think that goes
So,
for us also.
yes, yes, for everyone. I mean, we
Yes.
are individuals, end of the day, even we have a responsibility, correct? Yes.
Yes,
So
yes.
I think, Dr. Satish, that was a very well researched presentation. I mean, you have pulled out, references from authorities, who have been giving guidelines every now and then to medical practitioners. And I think it was a very good presentation. And I hope all our dentists and viewers who watch this talk, get something useful information out of it.
Thank you so much for the opportunity and cheers. I hope all of you will stay safe.
Yes,
God
yes.
bless.
Thank you so much, Dr.
Bye
Satish.
bye.
Thank you so much. Bye. Bye. So, hello viewers, that was Dr. Satish Kumaran who did share with us his experience about oral infections and especially the black fungal infection during this post-COVID time. I hope you all remain safe during these difficult times. And if you have any doubts or queries regarding this particular topic, don't hesitate to write to us and we will get back to you on that. So until next time that I come back with another expert who will share their expertise and knowledge about your health, keep smiling, stay safe and be happy. Thank you.